New COVID-19 infections among kids have now risen to the highest point since May. That's according to a joint report from the American Academy of Pediatrics and the Children's Hospital Association. This all comes as the highly infectious Omicron subvariant BA.5 continues to spread across the country. ABC News medical contributor and Stanford Children's Health physician Dr. Alok Patel joining me for more on this. I'll tell you what, Alok, it does seem like everybody is getting COVID now. I mean, those that I've known for years that have been able to avoid it are getting it. I mean, what's happening? What is making this so contagious?
You know, Kira, you're totally right. I feel like those people who were able to dodge the laser sensors are now running into it, some even more than one time with those reinfections. You know, it really comes down to the fact that BA.5 is one of the most contagious and transmissible respiratory viruses we've ever seen. You also compile that with a relaxed public attitude and the lifting of a lot of mandates. You put all this together and there's a lot of COVID out there, which is why we stress the message to parents, to anyone out there who's high risk, anyone out there who's acting lackadaisical, to hedge your bets against getting a severe infection, long COVID spreading into somebody else, and don't just assume that you're going to continue to avoid catching it. As you mentioned, numbers are rising the third consecutive week in pediatric cases, and that means that a small percentage will wind up in the hospital, but even some kids will get long COVID, with some estimates saying about 10% of kids will get there. We want to prevent all of this.
And so there's this new poll that's out also from the Kaiser Family Foundation. You know, we follow these polls, and it found 43% of parents with children ages 6 months to 4 years old say that they will definitely not get their child vaccinated. Since the rollout of the vaccines for kids under 5 nearly 5 weeks ago, you only have 544,000 of the 19.5 million children in the U.S. that have received their first shot. So why the hesitation still among so many parents? And do you think the kids still need the vaccine?
Here, I think the hesitation stems from multiple reasons. Number one, there are parents who simply don't trust the vaccines no matter what we tell them. They say they want to watch and wait. There's parents out there who also say, you know what? We don't think kids get really sick, so we're not going to put our young children through that as well. And there's others who themselves have not gotten vaccinated, and that population is very difficult to reach. And these numbers are staggering that they're that low. Even if you look at a hotspot like Mississippi and Alabama, you're seeing vaccination numbers in this age group as low as 0.4 and 0.6%. The vaccines are still needed to provide that broad protection and prevent kids from getting severely ill. But what's also needed, Kira, is open dialogue with these parents and making sure that we're hearing out their concerns, and we don't alienate parents out there for being what we call vaccine hesitant. So it goes both ways in terms of communication, not only for right now, but for moving forward with any other vaccines. And we've also seen a slight drop in those childhood vaccines as well. So what I would hate to see, what we are afraid that we're going to see, is a spillover of this mistrust against vaccines and misinformation into other life-saving vaccines as well, such as those for measles, mumps, rubella, and polio, which we just saw our first domestic case in about 10 years.
Wow, whoever thought that would come back. So this morning, the White House, yeah, exactly. I know. The White House is going to host this summit now, Alok, on the next generation of COVID vaccinations, and there's going to be representatives from Pfizer and Moderna. They're expected to be in attendance. So what's the goal here? And can these plans, you know, realistically work with the slowdown of vaccinations across the nation? Because there are also more reports that, you know, with the spread of this new variant, that the vaccine doesn't even work against that.
And that doesn't even work part is what is sparking a lot of conversation, Kira. People saying, hey, this vaccine doesn't prevent infections. And that's part of the goal of this summit, is to look to see what a long-term plan could be to reduce the amount of not only severe illness, but infections themselves, provide that sterilizing immunity. One topic that will be discussed is a nasal vaccine, which may be able to provide what we call mucosal antibodies. So antibodies that literally live in your nose that may be able to prevent infections altogether. There's some promising studies in mice, but we have a far way to go in terms of getting a nasal vaccine against SARS-CoV-2 in humans. Another conversation will be about a more broad coronavirus vaccine, almost like a general one that would be able to prevent multiple strains, and that may be possible by targeting a larger sequence on the SARS-CoV-2 itself, a larger mRNA sequence. But again, this is an early conversation. I'm glad it's happening, not only for this pandemic, but in terms of vaccine development in the future. But you're right, building public trust, getting those clinical trials, and getting the funding are all going to be really important factors.
Yeah, well, we need all of it. Dr. Alok Patel, thanks so much.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.